Good evening, nursing colleagues. Today I am here to talk to you about patient confidentiality, informed consents, and advanced directives. Confidential communication involves any information a nurse obtains about a patient in the context of the nurse-patient relationship. The Federal Health Insurance Portability and Accountability Act, HIPAA, was passed by Congress in 1996. It sets the standard for protecting sensitive patient information. The intent of this law is to ensure confidentiality of the patient's health information. It provides explicit guidelines for nurses who are in a position to release health information to maintain confidentiality. In order to maintain patient confidentiality, all nurses must have a basic understanding of this federal law. The use of social media and other electronic communication is expanding rapidly. Nurses are welcome to use social media in their personal lives, but it's imperative not to mention any patient information, or any other details that could possibly identify them in order to protect patients' right to privacy. Best practice for nurses to comply with HIPAA and privacy laws are using cover sheets on patient care documents and not displaying any patient information in plain view of visitors or other patients. Not discussing any patient information where it could be overheard, such as elevators, hallways, or cafeteria. Do not disclose any patient confidential information to family members without the patient's consent. Destroy any working documents, drug administration packages, patient summaries, and personal notes. Implement and maintain strict privacy access policies concerning computer and email use of personal electronic devices, and electronic transmission of patient data. The release of private health information, either unintentional or intentional, is a violation of HIPAA and is punishable by significant fines, imprisonment, and may also result in suspension or revocation of the nurse's license. Informed consent is a process by which a fully informed patient participates in the choices about his or her health care. For any patient to make meaningful choices about a particular procedure or treatment, the provider must convey certain information. Under the doctrine of informed consent, the physician or advanced practice nurse has a duty to disclose information so that the patient can make intelligent decisions. A properly executed informed consent must be in the medical record before treatment or surgical procedure, unless the surgical procedure is an emergency. A patient gives informed consent when the following three elements are met. Benefits and risks of the treatment should be explained to the patient. Consent needs to be voluntary, and the patient must not be under any influence or coercion. And the patient must be competent to give informed consent for a procedure. The nurse's role in the informed consent process usually involves witnessing the consent, which involves observing the patient's consent to the procedure by signing the consent form. It is also the nurse's responsibility to inform the physician prior to a procedure if a consent form is not present in the medical record. Advanced directives. Throughout their lives, patients are frequently faced with making complex medical decisions requiring them to choose between many options, to face uncertain outcomes, and to weigh the potential benefits and harms of treatment. But at no time is shared decision-making more important than near the end of life. An advance directive is a written statement of a patient's wishes regarding medical treatment, often including a living will, made to ensure the individual's wishes are carried out should the individual be unable to communicate them to a healthcare provider. Under a written living will, if the patient's condition is deemed terminal, or if the patient is determined to be permanently unconscious, life support systems, including artificial respirations and artificial means of nutrition and hydration, may be either provided or withheld according to the instructions in the living will. The nurse's role in advance directives is to educate, document, and communicate whether the patient has signed an advance directive or not. If the patient has signed an advance directive, it is the nurse's responsibility to make sure a copy is in the patient's medical record. The nurse should also communicate the existence of an advance directive to the physician. If no advance directive is in place, it is the nurse's responsibility to ask if the patient desires to create such directive. It is important to know what the nurse's role is when it comes to confidentiality, informed consent, and advance directives in order to protect your patient and yourself. Thank you for joining me.